Hello, True Health Seeker, and welcome to another exciting episode of the Learn True Health podcast. I loved doing this interview, and I know you're going to love listening. Dr. Anna Cabeca is amazing, and what's so funny is that she scheduled herself right after I had interviewed one of her best friends, Dr. Rita Marie, and they didn't know that they had scheduled themselves back to back. And so what's really cool is this episode is like an extension of the last one. I've seen this happen before where we've had guests book themselves in the same week doing 3 different talks on pain management or digestion or thyroid health. And I always think it's funny that the universe conspires to pull these experts together at the same time so we get different perspectives on the same topic. So if you ever notice that episodes really complement each other, it's not me. It's that the guests and the universe are bringing it all together to make this a great podcast. I really feel sometimes there's a little bit of divine intervention going on right now, just like the fact that after we had a great interview, Dr. Anna turned around and said, I really want to help the Learn True Health podcast. Would you like to be an affiliate? And so I'm going to give you 2 links, and those links allow you to sign up for her Breeze Through Menopause Masterclass and her book, The Hormone Fix. And if you do decide to purchase her book, for example, you go to these links, you decide to sign up, part of the proceeds are going to go back to support the podcast you love most. So thank you so much for supporting yourself and your health by getting Dr. Anna's book, The Hormone Fix, which is amazing for all women, not just women going through menopause. It has absolutely phenomenal information in there that I'm very excited for you to get a hold of. And if you're someone who is going through premenopause, menopause, or even after menopause, everything that Dr. Anna teaches in her Breeze Through Menopause Masterclass applies to you and will help you to literally breeze through menopause without having the horrible hiccups that can occur when our body is out of balance hormonally. So check out those 2 links. And if you do decide to buy her book, know that, feel all good and warm and fuzzy inside, knowing that you are supporting the Learn True Health podcast as well. And I have to say thank you to Dr. Anna for thinking about supporting us in our mission to spread this information and help as many people as possible to learn true health. So these 2 links are going to be in the show notes of today's podcast, but you can also go to them right now if you're not driving or running on a treadmill or carrying your groceries or whatever you're doing with both hands. If you do have a hand free, grab a pen or grab your phone and type this in: learntruehealth.com/breeze. That's learntruehealth.com/BREEZE. Or for my Canadian friends and UK and Australian friends, it's BREEZE. So it's learntruehealth.com/breeze. That'll take you to the page that describes everything you'll get from her, Dr. Anna Cabeca's upcoming masterclass on breezing through menopause, and for her book, which I highly recommend all women get, and especially the men can buy it for their wonderful ladies in their lives. learntruehealth.com/fix. That's learntruehealth.com/FIX, because her book is called The Hormone Fix. So you can go to learntruehealth.com/fix to grab her wonderful book, and learntruehealth.com/breeze to check out her awesome masterclass. Thank you so much for supporting the Learn True Health podcast. Thank you for sharing this episode with the women in your life that you love, that you know will make a difference for them as we move forward using food as medicine to heal our bodies. I know you'll love it. Please join the Learn True Health Facebook group as well, because Dr. Anna is going to be giving away a big giveaway. It was really cool. I totally put her on the spot halfway through the interview. I'm sure you'll enjoy listening to it. And she said, you know what, I'm going to do a big giveaway. She compiles a bunch of really cool stuff, and we're going to do a giveaway in the Facebook group. So if you love winning things, definitely go join the Facebook group, Learn True Health. You can go to learntruehealth.com/group, or just search Learn True Health in Facebook and find the group there. We've got a lot of great listeners. It's a wonderful community of everyone supporting each other, asking lots of great questions and learning from each other. It's a fantastic way to expand your knowledge base and get some great advice from other health nuts. So go to learntruehealth.com/group or find Learn True Health in Facebook. And after I publish the show, I will also publish a post about the giveaway so everyone can talk about the thing that they really loved, what they learned as they listened to this episode. So as you listen and you go, oh my gosh, that's such a cool thing, I didn't know that, then that is your thing. You go and you type it in the comments under the giveaway, and then we will choose someone at random. We will choose the winner about a week after this episode is published. So you guys have about a week to go run and do that. And if it's been beyond a week since it's published, no worries. Still join the group because we're going to continue to do great giveaways from other guests. Awesome. Thank you so much. And I look forward to seeing you in the Facebook group. Enjoy today's interview. Welcome to the Learn True Health podcast. I'm your host, Ashley James. This is episode 326. Well, ladies, today we are in for such a treat. And I know we do have some male listeners, and they can listen in too, especially to pass on information to their loved ones. This episode's going to be for ladies, though, especially women who are concerned about premenopause, menopause, and after menopause. We have with us an amazing expert, Dr. Anna Cabeca, here today to share her wisdom around balancing women's hormones, not only naturally, but also when is it time to take that next step into getting help from bioidentical hormones? When do we need to take that next step, right? And all the different options we have to make sure that we're as healthy as possible at every stage in our life. Dr. Anna, it's such a pleasure to have you here today.
It's great to be here with you too and your listeners, Ashley. Thank you for having me.
Absolutely. Now, I heard that your wonderful daughter, who wants to become a functional medicine practitioner, is the one that turned you on to my show. So we got to give a shout out to your daughter.
Oh, absolutely. Yes. My daughter, Amira, she's 19 and she's in her second year of college, and she'll send me an episode of your podcast. Mom, you got to listen to this one. Or, Mom, we were just talking about this. Listen to this, and it'll be your podcast. So she is an avid listener, as well as her friends. Apparently, she's getting everyone hooked. So I'm like, do you listen to mine? And she's like, not really, but she listens to yours.
That's so cool. Well, tell your daughter, well, I guess I could tell her, she's probably listening right now, that when she graduates and becomes a functional medicine doctor, I want her to come on the show and help the listeners and teach us. That would be so cool. I just love functional medicine. I think it's the future of all medicine, is looking at the body in a more holistic way and helping us navigate this world of health through diet and lifestyle and supplements and drugs when needed, but really knowing that there's so many more tools to support the body than just going straight to drugs, right? So there's this whole world that people are waking up to, and I'm so happy to be part of sharing this message and spreading this information that we can heal our bodies. Our bodies know how to heal. We just need to support it in the right way. Now, that's part of your story too. You had some hiccups in your health that led you down this path. We'd love to hear it. Please share your story. What's led you to become this amazing expert in balancing women's hormones? What happened in your life that led you down this path?
Yeah, I'm happy to share that too. And just before I forget, I know Amira will not forget that you invited her on your podcast now. There, it's 5-10 years from now. So excited for that. So my journey has been a tumultuous one, certainly, but I definitely headed off in my medical career because at a young age, I saw my mom suffer, and as a child, I think, we don't want to see our parents suffer at any age. And when they're hurting, it's devastating to us. And I remember being 16 and my mom at 52 saying that having to go into the hospital for cardiac bypass surgery. She'd been a
Oh my
diabetic for
gosh.
15 years and just struggled. And then she was having heart surgery and again, very few women at that time were undergoing heart surgery. It was a new procedure. I'm 52 now, so this was over I don't know how many years ago that she did this. And I was 16. I'm like, I have to figure out what's going on here. So I dug in the research, and lo and behold, none of the research was on men. None of the research was on women. It was all on men. And that's when I started to become this women's health advocate. And through her story and my pilgrimage into women's health, so to speak, I really needed to understand what's happening, why is it happening, and what can we do to fix it at its root cause. And that's why I fell in love with functional medicine. It's looking at root cause medicine. So from college, I did years of research and then went to an osteopathic medical school. And then at age 38, I was struggling with my health. My mom had passed away when I was 29. She had only lived 15 years after her heart surgery and struggled for a good amount of those years. And I was an Emory University trained gynecologist. And I really looked to try to figure out, okay, well, what can we do different? Why did this happen to my mom? And we gave her the best of Western care. And so that led me on my journey. But then at 38, post a traumatic event in our lives, I was diagnosed with premature ovarian failure and early menopause. So I was menopausal at 38, and I was tossing and turning at night, wide awake. Like I know so many listeners, if they struggled with hormone imbalance, tossing, turning, covers on, covers off, night sweats, and just unrest. And thinking back, my mom was 52 when she had her heart surgery. She struggled, and here I am, like on that same path, And here, my husband and I had wanted to have another child, and we were told we would never be able to have another child. The only option may be egg donation, but I'd failed the highest levels of reproductive intervention with my colleagues, my Emory colleagues, and so I was devastated. Here I was at 38, menopausal, hemoglobin A1C rising, on the road to diabetes, and that led me on a journey, Ashley. I actually took my two younger children, who were 7 and 10 at the time, and we journeyed around the world. It was my healing journey around the world to just kind of find answers. I was devastated, depressed, struggling, and that led me to find natural solutions. I needed natural solutions for what I was going through because everything I had in my Emory doctor's bag wasn't working. It wasn't working, and I wasn't willing to give up hope. And that's something I totally encourage listeners, because never give up hope. I don't care how old you are, what you've been through, what diagnosis you've been labeled with, but don't give up hope, because there is the opportunity to improve our health no matter what state we're in right now. And so that was my journey. And lo and behold, at age 41, I delivered my now youngest child, Ava Marie. So she's 10 years old now. So I'm 52 with a 10-year-old. She's soon to be 11. It's I'm the age my mom was, and I'm healthier than I've ever been in my entire life. So through natural solutions, no prescription medications, so really natural solutions. And that's what I've taught, and that's my passion, to re-empower women and men and families to be their physician, to heal their body, because it's 90% lifestyle and nutrition. 90%.
Now, just to clarify, so you're a medical doctor, right?
Yes, yeah,
So,
OBGYN, and I'm
right.
actually triple board certified. So after getting my Emory degree in gynecology and obstetrics, I went on to train in regenerative medicine and then also integrative medicine. So I'm triple board certified. I don't discriminate, and I keep looking for answers.
Right. And this is, I keep hearing, is that those medical doctors who are the most successful at helping people have the biggest open minds to continue to seek answers. And they know that it's no one profession no one philosophy has all the answers, and we can keep learning from each other. You say it's lifestyle and diet mostly. When you went through your medical school training, it was that did you learn that in,
No,
or
no.
I mean, do you see what I'm getting at? It's like
Mhm.
you see now, and you're saying now you help women successfully go from hormone problems to fertility if they want, or hormone problems to balanced, and bringing them back into health. And you're seeing that diet and lifestyle are the biggest things we need to shift, but you weren't taught that in medical school.
No, no, not at all. And in fact, I think many of my colleagues as well that have found themselves in this more holistic type of practice is because we've also been kicked in the butt. I think open mind partly, but our mind's been hammered in. We've been opened up to it because, often we realize it. I think with my experience, I definitely was open-minded to food as medicine. I grew up with a Mediterranean family. Like this is what we need to eat to be smart. This is what we need to
Mm.
drink if we're not feeling well, and the list went on. And so I grew up with that. And then I went to an osteopathic medical school because I wanted to understand how to empower the body to heal itself. So structure and function, hugely important. And then, it was like, okay, well, who's my next teacher? And that's kind of the journey that I took. But it was really opening myself up to realize and to humble myself up to
Mm-hmm.
realize that my clients have a lot more power over them than I do, and that's so true. And one thing I mean, it really comes to the numbers too, Ashley, because, I trained and I know that I can write, I can do surgery. I'm a gynecologist, did hysterectomies and surgeries to remove cancers and deliver babies and just name it. So I went from doing 2 to 3 surgeries a week in my patients, to 2 to 3 a year when I figured out how to empower them naturally through natural supplements and or natural hormones to heal their body. That was a huge realization. I saw the symptoms disappear.
That blows my mind. And do you feel that when you were doing 2 to 3 surgeries a week, you were being conservative, or you were relying on surgery as the one of the first measures?
I was using what I had in my tool bag. And that's a great
Mm-hmm.
question. I really felt like I was being helpful. Okay, look, you've got fibroids, you have pain, it's irregular bleeding. Of course, that's causing you problems in your life. We remove your uterus and you won't have those problems. Birth control pills didn't work, antidepressants didn't work. Let's just, I mean, whatever the situation was, right? And so conservative, certainly, because definitely wanted to try natural regimens. And it took me a good decade probably to refine my methods, my approaches, and definitely through nutrition, lifestyle, detoxification approaches, everything that I put in my new book that's coming out to really empower the individual. And so realizing like, oh my gosh, so this, can I give you an example, Ashley, of a
Sure.
patient coming
Yes,
in?
please.
So, for example, a 36-year-old patient comes in and she's complaining of mood swings, PMS, irritability. And it reminds me, I always tell my clients, if you only hate your husband 2 weeks out of the month, it's probably your hormones, not so much your husband, right? So physiology drives behavior. So here we are experiencing these PMS symptoms, irritability, hating our husband, whatever, 1, 2 weeks out of the month. And so the treatment of choice is our antidepressant therapy. So here's a prescription for Prozac or an SSRI. We've got so many now, right? It's one of the
Mm.
number one prescribed medications. So here's the antidepressant or anti-anxiety medication, and I'll see you back in 3 to 4 months and see how you're doing. So it'll take a little while to work. Patient comes back in, still struggling, irregular bleeding, cycles are more problematic. So the next standard of care is let me again put you on the birth control pill. That'll shut down your ovaries, and heck, you can stay on that till menopause. Not true, but you can stay on that till menopause, and that should take care of your symptoms. Well, you're still having breakthrough bleeding at your follow-up visit and uncomfortable, gaining weight, no sex drive, and recognize, still having uncomfortable periods. Maybe fibroids are getting bigger now that you've started the birth control pills. And so the next course is, well, we can take out your uterus. And since you're over 35, we can take out your ovaries while we're there. So you don't have the very minuscule risk of having ovarian cancer, kind of the standard. And now much more conservative in ovarian surgery, but now I've been in practice 30 years, right? Or have 30 years clinical experience. It's been a long journey. So maybe more ovarian conservation's going on now, but that was certainly a recommendation, feasible recommendation. And so then the client comes back in and still, having mood swings, less pleasure with sexual intercourse, possibly uncomfortable. And we've done everything we can as a gynecologist. Let me refer you to a psychiatrist and a divorce attorney, because, hands done everything in my doctor's bag. So change that approach now to client comes in at 36 having irritability and mood swings, and I say, okay, well, let's look at your nutrition and diet. What are you eating? Here's the 21-day detoxification program. And now in my book I have a 10-day quick start keto green detox is what I call it, so even shortened it to get quicker results. But 21-day detox. And while I'm waiting for your lab results, follow this plan and come back in for your results. And maybe, depending on her age or what she was experiencing, I may have added a supplement, my Mighty Maca Green supplement, an herbal supplement that I learned the ingredients of when I traveled around the world that helped me. So I would put patients on that. So that's probably 2009. And put her on that formula and the detox and had her come back in 6 weeks. 6 weeks later, this patient comes back in. She's already feeling 80 to 90% better. Already feeling like, oh my gosh, I didn't know how bad I was feeling till I started feeling good again. Or, I'm not experiencing these symptoms, and symptom questionnaires would drop by 30 to 70% in those 6 weeks. And just see that difference. And then looking at the labs, maybe we add bioidentical progesterone, we work on nourishing, but we keep on a functional food, nutrient rich type approach and support hormone balance in that way with natural herbs, natural food recommendations, and a medium-sized list of things to stay away from: artificial sweeteners, sugars, many types of grains, and substitute that with healthy greens and healthy fats. So that's the approach that took me and my clients from 2 to 3 surgeries a week. Again, some minor, some major, to 2 to 3 a year.
Phenomenal. When you were developing this, obviously over time, you said it took you about a decade to get to where you are now. You started with yourself, right? You started by, you were seeking information to heal yourself. Can you walk us through what that looked like as you traveled around the world and looked for these answers? Can you tell us some stories of some aha moments you had along the way?
Yeah, I'm happy to. I think about some of the aha journeys, and Ashley, for me, it was being diagnosed with infertility. We had suffered an unimaginable loss and trauma. We lost our child. We lost one of our children in a traumatic accident. And I, hormonally thrust into menopause, depression, from a state where, I didn't want to live. I was 38 years old. I mean, a passion for life with no desire to live it. And that's what I was dealing with. So hence the healing journey, a private time of grieving, and keeping my family close to me, as close as I could, and protected as I could. And so that was what spurred us on to this journey. And in the journey, one of the places that I traveled all around. We went from visiting Native American shamans to Andean healers to Brazilian medicine man to, just name it, some of the leading scientists in the world from Australia, Israel, Germany, and France. So it was quite an interesting journey that was serendipitously designed. I mean, it was incidental versus very planned. And from here, I remember being in northeastern Australia and hiking up a mountain at 4 a.m. after doing a 3-day fast. And all of a sudden I was slipping. And this is a state, I just, knew I had to keep going, but had no desire. And I was slipping down this mountain really fast, close to the edge. And all of a sudden I knew like I'm heading over this cliff. It's 4 a.m. I'm 4,000 feet up. And my hand just shot out and caught this small branch that should not have held me, but it did. And I heard loud and clear, and I know, I feel like God spoke to me and said, "You will survive this." And so that moment brought me to tears like, oh my God, I have to survive this. Like, I have no choice and I have to survive this. So that realization said, well, how then am I going to survive this? And how am I living in as an example for my 7 and 10-year-old daughter and my 15-year-old stepdaughter? And how am I living as an example for them? And that was the aha moment. And so from everything that I was learning, I had to learn, I wanted to learn how to do it well for me and for others, because I knew as I met people along the way who'd suffered losses, who had diagnosis of cancer. I mean, I tell you, God put people in my path. And I knew that it wasn't just for me. I had to find answers for them.
Mm-hmm.
And so that was part of the realization, the discovery process that led me to be a truth seeker. And how do we empower our bodies to heal itself? So if I was going to survive, I wanted to do it well.
Brilliant. And out of the first changes you started making to your life, obviously you were coming out of grief and depression. When did you start to see that your fertility was coming back? When did that, was that your goal the whole time, to get your fertility back, or was your goal just to be healthy and grieve healthfully and somehow come out of the other side of the grieving from the loss?
Yeah. So when I was diagnosed, by my esteemed colleagues as premature menopause, which we know is very unlikely, if ever, or premature ovarian failure and early menopause, it's unlikely, if ever, to be reversible, right?
Mm-hmm.
That's the very, very 0.001% chance. And so I had given up that hope. I mean, I wanted to, but it was like, okay, well, here I've been crowned with this diagnosis. Yet there was the seed of hope in me. I still so wanted, I guess seed of desire within me versus hope to have another child, just to not replace our child that we had lost, but to just bring such life and joy back into our family that was definitely missing.
Mm-hmm.
And so there was that desire, but the journey was in and of itself a probably a family trait, because my mom always told me, travel is one of your best educations. And you learn from other people and other cultures. And so that's what I was going for. I mean, I didn't plan to meet different healers. It just kind of showed up, or I just asked the questions and was led to. Really, it's kind of interesting how, but I think that they say, there's an expression, when the student's ready, the teacher will come.
Right.
And so there was that part of my experience, and just continuing to ask questions. Well, how do people here deal with grief, if it's in their family, if it's a child? How are people dealing with menopause here? How do women handle it? What's the discussion around it? So I asked these questions, and that's where I kind of started finding some root remedies. For example, in Peru, when I asked, I was infertile, and they said, well, if you're infertile, drink maca. And if your baby's not thriving, drink maca. If you're tired, drink maca. And then they elbowed my husband. It's the Peruvian Viagra, have some maca. And so, so me as a scientist, I'm like, okay, well, what's in this maca, right? And here, maca grows above 11,000 feet in Peru. It's indigenous to Peru. It originates there. And it has macaines, just specific protein that's not found in any other tuber or plant. And maca is an alkalinizing cruciferous vegetable. So we know the cruciferous family is good for breast health. It's also very rich, because I had to break down and understand, well, why does, don't sell me snake oil, right? What is this? The skeptic in me said. And so maca is rich in arginine. Arginine increases nitric oxide. Nitric oxide is exactly how Viagra works, right? A vasodilator and improves blood flow. So, and it also has a good amount of histidine to help with orgasm. And it's very fascinating root. So I was drinking that, but I tell you, I hated the way it tasted. So I started with my food as medicine background, making some tasty combinations. So adding some adding some fruit or greens, and that's how my formula Mighty Maca came about, just adding different things. And I do believe that helped. We know maca is an adrenal adaptogen. I've included turmeric and quercetin and resveratrol into my formula, and those are adaptogenic as well. And so I think there's that like I said, serendipity of bringing these things together in a way that looks good, tastes good. That helps too. And that was part of the journey, just exploring and being open-minded to look for any answers at that point. I had to find answers because everything that I knew, um, I recognized just wasn't enough. And another example of that is, I had gone from breastfeeding to completely never having another drop of breast milk again after the trauma. And that is, for any woman who's missed a breastfeeding, even by an hour, your breasts get really engorged and tender. That never happened. There was a complete, HPAT axis shutdown. So hypothalamic pituitary adrenal axis. If I intellectualize the physiology of what I experienced, which I've spent many, many, probably years doing now, can recognize that complete neuroendocrine axis system breakdown. And it's what people experience with PTSD, post traumatic stress disorder, and to a certain level, adverse childhood experiences. And these tend to rear their ugly little head in the perimenopause time period when our hormones, our neuroprotective hormones such as progesterone, are dropping. And then we're more likely to have exacerbated symptoms.
Can you explain that a bit more? So is it the HPAT access is that only specifically for breastfeeding, or was that
Yeah.
for other hormones?
Yeah, absolutely, for other hormones as well. So when we're under stress, we get an outpouring of cortisol. So our adrenal glands predominantly produce our cortisol, and so what we experience is when cortisol goes up, our hormone oxytocin goes down eventually. And oxytocin is a hormone of love, bonding, and connection. So people who have experienced, and also in order, when cortisol is going up, progesterone levels are going down. So another neuroprotective hormone, the primary hormones that we think about in in our reproductive years is progesterone, which is that hormone of the second phase of our cycle, the mother hormone, so to speak. It gets the uterus ready for a pregnancy to implant. And if it doesn't, that progesterone levels drop and we have our period. Estrogen levels, fluctuate monthly through our adult lives. And but progesterone starts to decline in our mid 30s. It's also the precursor to production of cortisol. So you can imagine if we've got, a bucket full of progesterone and we've got a big hole in it pouring out cortisol, we need to keep trying to replenish that progesterone. And sometimes we can and sometimes we can't. The older we are, the harder that gets. And so when cortisol's being poured out, that's your, fight or flight responder system. It's your body's natural anti-inflammatory, the natural rescue hormone. So we absolutely need it at times of crisis. It keeps us grounded, keeps us, on higher alert, more vigilant, quicker able to react. But over the long haul, that burns out burns out our system. I was thinking about it like if you can visualize a network of circuits, kind of like electricity going everywhere as they fry themselves out. That's what happens over the long haul. It's not very medical description, but it gives you a visual.
It's okay. I love using car metaphors for health, so it's totally fine. Um, so when we have high stress, or if we've had several adverse childhood events, so we're more wired towards being in a state of stress, meaning the autonomic nervous system, sympathetic nervous system response has kicked on. So we're not in rest and digest, we're in fight or flight. And our cortisol levels are higher than we'd ideally like them to be. Our progesterone goes down, and progesterone is a neuroprotector. Can you talk a bit about
Yeah.
that?
Yeah, so research out of Emory, has looked at progesterone as therapy for traumatic brain injury. So we have
Mm.
progesterone receptors in our brain. Now, in gynecology, we think, okay, well, the uterus, if you don't have a uterus, you don't need progesterone. That's absolutely not true. And the point is, our brain has progesterone receptors, our breast, our bones, our fascia has progesterone receptors. So it's not only a neuroprotective hormone, it's a protective hormone overall and a precursor hormone to other hormones. So it's important to understand that. Progesterone has the ability to improve memory, improve cognition, improve response time, um, and definitely progesterone converts to allopregnanolone, which is associated with the neurotransmitter to help produce the neurotransmitter GABA, which is our relaxation, our natural anxiolytic hormone. And a good way to think of that is I always think of GABA. Remember the rock group ABBA makes me think of the musical Mamma Mia. And then I'm like, oh, this is a feel good hormone. Yes. So progesterone, GABA, feel good combination there. And yeah, so that's kind of the roles of progesterone predominantly in our bodies.
Wow. And men have progesterone too, right?
Yes, absolutely. To a lesser amount than women, but they do. And from a prescription standpoint, progesterone we have some topical creams that are available with progesterone, but it's also available by prescription. And so for women, for postpartum depression, for PMS, for perimenopause and postmenopause symptoms, progesterone is often bioidentical progesterone from functional medicine providers and or anti-aging specialist is often a first choice therapy because it is one of the mother hormones.
And why? So let's talk about low progesterone, because I think that's kind of become a little bit of an epidemic. But so stress being one of them, that's a major issue, and that's where you come in, where you say lifestyle and diet are some of the the biggest medicines we can use, because if lifestyle is constantly contributing to high cortisol stress levels, that's driving down our hormones. And so, that's where we need to carve some time out every day to do things that turn off the stress response. And we need to shift our lifestyle so we correct sleep, make sure we're moving our body in a way that brings us joy every day, eating food that nourishes us, taking some breathers, laughing, hugging, dancing, whatever it is that brings us joy. That as women, I feel we constantly put off on the sidelines to take care of others, or put out fires in our life, and think that it's not important for us to take little time out for ourselves every day. But now, the way you describe it, it's really important. It's really important to manage the cortisol levels and bring them down. But beyond stress and cortisol, what other causes contribute to low levels of progesterone?
Yeah, well, first, one of the things that you said, about lowering cortisol, you talked about oxytocin boosting activities. So the laughing, hugging, dancing, everything that brings you joy increases oxytocin. Anything you do to increase oxytocin naturally puts cortisol back in balance. So I just want to emphasize that there. That is so
Mm.
important. Sex, intimacy, orgasm, all of those increase oxytocin too. So put those on your checklist.
Nice. Excellent. I love it. Yeah, it's so important to have the tickles and the hugs and the dancing and the cuddling and the human connection, right?
Mm. Absolutely. Absolutely. That community, the sense of community, and that improves our longevity. Oxytocin's I call it my crowning hormone, the most powerful hormone. I talk about it in my book quite a bit because it is the anti-aging hormone. We know higher levels of oxytocin. It doesn't matter how old we are, even research done out of Berkeley looking at people post their 70s and increasing oxytocin, increasing activities, improved muscle growth and muscle cell regeneration. So at any age, oxytocin is so valuable. It is the ultimate anti-aging hormone and gives us that sense of peace, that joy, that connection.
Brilliant. I love it. And so, further details about how to make sure we're increasing our oxytocin are in your book.
Yes, yes.
I love it. I
Yeah.
like that you make sure that you emphasize that because again, it's people go, "Oh, that's so woo woo." Like we think, come on, tell me what bioidentical hormone I need to be on. Tell me what diet, what I should and shouldn't eat, and how much should I sleep? And we think that it has to be something very tangible and physical and measurable, and then when we think of, you mean I should like cuddle my kid and have a dance party in my living room and watch some comedians on YouTube and go for a walk, and those activities are as important as what supplements I take. And it's to emphasize that, to let us know that yes, carving out time to laugh and increase your joy will show up in your labs in a few months. The more you
Yeah.
increase your oxytocin, you can see it. You can physically see shifts in your health and in the labs. The more you have joy, the more you play in your life. So we need to give ourselves permission to laugh and have more joy.
100%. I agree 100%. And like I like how you said it's not woo-woo science. It is not woo-woo science. We've got some great hard science on this, on positivity, on appreciation and gratitude, on these behaviors, these lifestyle behaviors, and nothing in a pill or nothing I can write on a prescription exceeds the benefit of our bodies producing more oxytocin naturally. And any one of us can do it, despite what trauma, despite what diagnoses we have too. So I'll just give you an example. We have a new puppy in the house. Puppies are definitely oxytocin producers for sure until they go to the bathroom in the house. But besides that, they're incredible oxytocin producers.
Can you please prescribe me a puppy?
I will. I will.
I'm friends with a naturopathic physician who she says, every time my clients, my patients come back from Hawaii, all their symptoms have gone away. So I'm gonna have to start prescribing trips to Hawaii because things I've been trying to treat them for years, and then they go to Hawaii and they all get better. It's just a 2-week
Exactly.
vacation and all their things clear up, right?
It's so, so true. And another way to look at too, like I think of that, I always like to tell my clients, like, I would hear in my practice, Dr. Ann, I went on vacation and I got sick while I was there the third day. And I'm like, oh, well, that makes sense because you've been under so much stress. You were pumping out so much
Mm.
cortisol that suppressed inflammation in your body until you took away that stress. Your cortisol went back
Mm.
down and that inflammation was allowed to override. And so that's a sign that you're really pushing those adrenals too hard. So anyone who's ever experienced that, and I know it happens probably more often than we'd like to, because we go on vacation, we want to feel better, but I'm sick on vacation. What happened? That's exactly what's happening. So important to look at that as a red flag that we need to do some much more self-care, much more stress reduction practices.
Love it. Very, very cool. So, getting into the other causes that would lower progesterone, what else do we need to look for in diet and in lifestyle that would contribute to lowering progesterone, and how do we correct that?
Yeah. So often, like one of the things we see with low progesterone is we experience this estrogen dominance. So, first, some of those symptoms I talked about, the PMS, the hot flashes, the irregular periods, the irritability, the hating your husband 2 weeks out of the month, is estrogen dominance, hence low progesterone, kind of going hand in hand there. But we can get this experience of estrogen dominance because we have so many estrogen disruptors so we can have from a increase of what our body's producing estrogen wise through, if we have constipation, we're getting recirculating toxins and estrogens back into our body. If we're drinking plastics exposed to parabens or other endocrine disruptors, they can inhibit the function of our estrogen receptors and or act or mimic estrogen in those cases. And so we have this estrogen dominance. And so we need to do two things when we're experiencing low progesterone. We need to clear out the excess estrogen, improve, so this detoxification comes first, and then empower our body to naturally have healthy balance of progesterone. We experience low progesterone naturally just with aging. When our ovarian function starts to decline in our 30s, we're not producing as many eggs or follicles each month, so our progesterone levels naturally start to decline. So we have the natural decline of progesterone, and we also have it because of stress and because of toxins. The same reasons that we get estrogen dominance apply to low progesterone. And what that's experienced at is that difficulty sleeping, the irritability, the waking up in the middle of the night, again, the PMS, and those symptoms as well are all associated with low progesterone.
So you're saying that estrogen dominance causes low progesterone, or that it's the imbalance between the two?
Yeah, the imbalance between the two.
So someone could have healthy levels of progesterone, but if they have estrogen dominance, then it is the ratio that's out of balance that causes the problems?
It's the ratio that's out of balance. So it can be both, but it's predominantly the ratio that's out of balance. So we have symptoms of excess estrogen, not being able to clear our estrogen enough, and not having enough progesterone. And so it's the combination of the two typically.
Mm. And what do we do? Like, where do we start?
So after the woo-woo, after the stress reduction techniques, after, self-care and, detoxification. So when I talk about detox, I talk about really improving nutrition in our diet. So improving nutrition from the foods we eat to the clear water we drink to the what we're not doing too. So from removing the toxins from our body from alcohol, from sugars, from preservatives, from artificial sweeteners, from chemicals in our skincare products. We have to go at it from both angles.
Mm-hmm. I was just going to ask you about sugar and what kind of role does sugar play in affecting our hormones?
Sugar is a huge culprit. So I hate, because sugar is going to increase our blood glucose, and that's going to increase our insulin, which then further can disrupt progesterone and other hormones as well. So sugar is a big culprit. In my book, I talk about the keto green way. So I'm a big fan of getting our bodies into ketosis. So having intermittent fasting, having very low carbohydrates, but healthy low carbohydrates, leafy dark greens, and cruciferous vegetables are my carbs of choice. Eliminating other sugars, including many fruits we eat. I mean, there are seasons for a reason. Every day we do not need fruit. Fruit is sugar too. So often we think, okay, well, I'm having this muffin and fruit, and that's a good breakfast. Well, that right there is probably over 100 grams of carbohydrate, and that's too much for our body. And that's going to, especially in the perimenopause, postmenopause, when we're experiencing these hormone imbalances, we really need steady state blood sugar control. So we have to remove the highs and lows that we experience from ingesting sugar. Anytime we have a meal with sugar or carbohydrates in it, I mean, even a healthy meal, we're going to get a spike in glucose and a spike in insulin. And the more glucose, the more insulin that's needed. And that's where some people start to struggle with hypoglycemia or low blood sugar reactions and things like that. I've completely gone off topic of your question, I think. What was your question about sugar? So sugar just being that culprit, right?
Right.
And so I just encourage a very low glycemic, a low carbohydrate, but healthy carbohydrate. Get enough of all the nutrients that we need, nutrient dense foods, but to stay very, very low sugar. And, I produce a keto green shake that's 0 grams of sugar, Mighty Maca, 0 grams of sugar. And we want to really look at foods that are empowering our body, that are healthy. And a great example of a keto green breakfast would be smoked salmon with capers on tomatoes and onions with a handful of fresh or steamed spinach. That's a perfect keto green breakfast. Your carbs in that whole meal are less than 5 grams of carbs. So you've got healthy protein, healthy fat. You can drizzle some olive oil on there if you wanted. So healthy protein, healthy fat, that's perfect. And that's going to keep your blood sugar healthy till, 5 hours or so later to your next meal.
Since you described breakfast, now I'm hanging and I want to know what lunch and dinner look like. So can you give me some
Perfect. Good.
examples of lunch and dinner?
Yeah, I'll tell you what I had for lunch today. Today I had a salad based on arugula, cilantro, and mint. So those were my greens, and I had a curry chicken salad on top of it. So it was, just chunk chicken, really easy with mayo and extra olive oil with some turmeric or curry seasoning in there, and some cut onions. What else did I put in there? Onions and some sprouts, and I think that was it. That was it. And so drizzled with olive oil and olive oil vinaigrette.
And what
That
is
was lunch.
that? That sounds delicious. What does dinner look like?
Okay, well, dinner last night was bone broth because I was doing like extended intermittent fasting. So dinner last night was bone broth, but tonight it is. I have tabbouleh salad made. So that's tabbouleh, a parsley salad, but instead of the grains, usually they use cracked wheat or bulgur in tabbouleh. So instead of that, you could use cauliflower rice, like brown cauliflower. But I started using broccoli sprouts chopped up because it gives that crunch, and then it's delicious. Soaks up the juices really well. So it's parsley, some sprouts, cut tomatoes and onions with a lemon juice, olive oil dressing with actually have spare ribs tonight for dinner. So.
And are you always in ketosis, or do you recommend that women who are looking to balance their hormones always be in the ketogenic state, or simply go in and out of it, or just as long as they're eating low carb, healthy fats, and lots of greens, you're happy?
That's a good question. So just between me and you, no, I like to, have beautiful celebrations, feasting, party, whatever you want to call it. So I have this, 10-80-10 rule. So 10% fasting, 80% eating keto green, or, getting your body ideally at least 3 days a week into ketosis. And then you can have your feast days. You should have feast days. So metabolic flexibility is really important. So from fasting to feasting to some moderation in between, and what keeps you there and keeps you healthy. Because what I found with women going through, with myself and with now thousands, over 100,000 women going through my online programs, is that women generally, number one, are confused about what's happening to our body and are just in a state of confusion come perimenopause because we're getting brain fog. We're not sleeping well. We're not rested. Our moods are all over the place. Sometimes we don't know who this person is inside our bodies anymore. And so this clarity, getting into this keto green state, getting a nutritious body, where I always have clients check to make sure their urinary pH test alkaline, because they can discover if they're getting enough nourishment, if they're managing their stress well, just from doing that simple, cost pennies, anyone can do it, test of their urine. And then periodically getting into ketosis, that combination brings about this clarity, this heightened level of awareness. And that is a state you really don't want to leave. So, but there are times when we're going to celebrate, and there are times when we're going to fast. So that combination, having that metabolic flexibility, is kind of my rule of thumb at the moment. So
I like it. Now, some women who've gotten to this point where their hormones are balanced, they also have problems with their liver. Maybe they have fatty liver, but they're having problems with their liver, and maybe they're also, like you said, have constipation. So now they're reabsorbing so they have problems with their digestion. The liver's involved. They're reabsorbing their estrogens. Is it recommended that they get into ketosis and they stay on a ketogenic program at least 80% of the time with elevated liver enzymes and sort of like an insulted liver, or do you have a program to help women to make sure they're getting their organs as healthy as possible so they can handle a ketogenic state?
Yeah, no, that's a great question. So when women have fatty liver disease, one of the best things that we can do is intermittent fast. That is one of the best things we can do is give your body times to rest and restore, but really approach getting alkaline. Stay low glycemic, but really start checking urinary pH to get alkaline and support phase 1 and phase 2 liver detoxification. So what do I mean by that? So the way our body, we take food in, it gets broken down and digested, and then we send it through our body we detox through the liver, our enzyme systems through the liver, kidneys, and then we should excrete it through, excrete waste through urine and through our stool, right? So that's our normal healthy, and exhale through breathing, carbon dioxide. We will exhale byproducts. And so it's important to understand that when we have elevated liver enzymes, whatever the cause, that we know that we have to support this detoxification process. And many people are aware of methylation. Methylation, we talk about methylated B vitamins or the MTHFR gene. We need to support methylation because that's one of the way our body takes toxic compounds and makes them less toxic so that they can be removed safely from our bodies. Methylation is one way, sulfation and glucuronidation are another way. So using foods to support that, the dark leafy greens, the cruciferous vegetables, eggs, healthy proteins and healthy fats can all help with that process. So we can also supplement. And I use supplementation in my practice. So I've made formulas to help with detoxification, the Mighty Maca Plus, my Keto Green and Keto Alkaline shakes, and also formulas that contain additional like milk thistle and celery root and cilantro and chlorella and different things that we can supplement with that. We can also do a good amount through what we're getting from our diet. Our diet is so powerful. When we're eating straight off of nature, as close to, freshly picked or grown or killed, that makes a difference to our body. There's an energy that's with that. And what I've seen in my clinical practice, clients with elevated liver enzymes, when we follow this keto green detox approach with or without additional supplementation, those liver enzymes go down. So we can see that improve quite significantly.
So you're saying that the diet itself is therapeutic, and even though their liver is damaged or insulted or inflamed at the moment, it's going to start to be healed through a low glycemic diet filled with antioxidant-rich foods that support it. Because I know with the traditional keto is very high in fat, and if the person already has, maybe they don't have their gallbladder, or maybe they're having gallbladder problems, or they have a sluggish liver, so they're already having problems digesting fat. How would you address that as you transition them into this lifestyle?
Yeah, I would go just with natural healthy fats, not so much like when I think ketogenic, I think empowering the body into ketosis. So if you're looking at your plates, kind of like what I recommended, that type of eating is perfectly fine. But I hear what you're saying, because when we think ketogenic diets, we're often thinking bacon, meats, that kind of now there's even carnivore keto, and I wouldn't recommend that to anyone with elevated liver function, fatty liver, or gallbladder disease. That's not the best way to go. We're going to need to go slow and cut back on, the amount of fat that we're eating or ingesting, and also the amount of red meats that we're eating. So it would really even lay off of red meats initially if we're dealing with those elevated liver functions, fatty acid, or gallbladder disease. And any client that I've had with gallbladder disease, because we see it very commonly in women with estrogen dominance or postpartum, we'll often see gallbladder disease. And the one way to help with that is to add enzyme support. And there's a product that I've used. And if you don't have a gallbladder, I highly recommend supplementing with enzymes to improve digestion that completely improves fat digestion. There's a product that I've recommended quite a lot to my patients with 100% success if they've have gallbladder disease or a history of having their gallbladder removed. It makes such a big difference.
And what's that product?
That product is called LVGB, so liver gallbladder complex. It's by a company called Designs for Health. And I have no stock in that, nothing. It's just one of my favorite products that I found clinical improvement with, LVGB complex by Designs for Health. I believe it's available on Amazon even now.
I think I might be a little too intense to say this, but I think it should be almost criminal for a surgeon to remove a gallbladder and not inform the patient that the rest of their life they won't be digesting fats correctly, that their liver's just going to be constantly dripping instead of storing and pumping out all the bile it needs. It's just going to be dripping. So if that person needs to either make significant changes, like eat a low fat diet the rest of their life, which could come with its own complications, or they need to support their digestion. And unfortunately, this education, at least from all the people I've talked to that have had their gallbladder removed, have never been informed that they need to support their body in digestion, at least with some kind of bile support. Isn't that frustrating that people have
100%.
major surgeries, have things taken out of their body, and then they're not told how to best support their long-term health?
I agree. I feel the same way about progesterone. When people are told, well, you don't have a uterus, you don't need progesterone. Bioidentical progesterone, we have receptors in our bones, breast, brain, fascia. I mean, it's important. So I feel the exact same way about that. And yeah, no, I mean, I agree 100%. And it does make a difference. It changes the quality of life as an individual, and we need healthy fats. The 80s movements of the low fat, high carb, that's destroying. We're still, women in perimenopause, men too, andropause, suffering with low hormone levels. We're struggling from those fat deficient times or high carbs times, because we're insulin resistant, we've got leptin resistant, I mean, just name it, right? We're suffering. And we need healthy fats for our hormones, especially as we're getting older. We need healthy fats for brain function, especially as we're getting older. A little bit goes a long way. We don't need pounds and pounds of it, but a tablespoon of MCT oil is, I was looking at that on Weight Watchers for a friend the other day. It's like 7 points on Weight Watchers that may be like a quarter or a fifth of someone's entire meal plan for the day. So a little bit of fats go a long way. And I agree. One of the other areas that it just aggravates me, and it's one of my pet peeves, I want to share this with you and your audience, is how important checking labs are. Because by the time we're seeing, the elevated liver functions, or by the time we're seeing symptoms, or signs in our routine blood work, we've been struggling for years. And so knowing a few key lab markers is really important. And one of them, and I can share them with you if you'd like, just a couple.
I'd love that. Yes, please.
Yeah, and I go through it in my book, and including resources with some more of the cutting edge lab tests that help us dig deeper. And a lot we can do now as our own detectives. I'm a big Nancy Drew fan. I read every book when I was 10, and just trying to get every one of my daughters to read her books. But I feel like, we need to be our own Nancy Drews and discover what's going on with us, look at the clues, and help us solve the mystery of us. And so one way to look at that is some key lab markers, and very simple. Often now, people are starting to check this one. It's our vitamin D level. We need to check it in the right way. We check out vitamin D 25 hydroxy, and all of these are in my book, but vitamin D is really important. And I'm with you on that anger factor, because if you've had your gallbladder removed and you're not on enzyme support such as milk thistle and taurine and some methylated B vitamins, we're doing you a disservice. But if you've had any cancer, and this is a client, I've so many times a client would come to me, they'd been diagnosed with breast cancer and referred to me for some integrative care, and I would check their vitamin D level. And I never forget this beautiful woman. She came to me, she was 67 years old. She had been diagnosed with breast cancer and treated with chemotherapy, and she was really struggling. And so she ends up to consult with me. And first thing I checked was her vitamin D level, and it was 11. 11. We know that anything less than 50 does increase our risk of cancer. So why did this woman get rounds and rounds of chemotherapy and no one cared to check her vitamin D level? And the higher our vitamin D level, the less likely we are to get cancer. Of course, we want it to be naturally elevated. And so I worked with her with vitamin D therapy, but what do? We get outside, no eyeglasses on, get sunlight exposure, and do try to get as much of natural vitamin D. And we get a lot more than vitamin D from the sun, but that's one of our markers, one of our markers that we can detect. And vitamin D is so crucially important, not just for what we know we know that it improves depression, it improves our autoimmunity. The higher the level, the less likely we are to have cancer, breast cancer, heart disease, diabetes. So we want that vitamin D level to be between the 50 and 80 range, and an optimal range, not just normal range. Your labs might say 20 or above is normal, because below 20, you're likely to get rickets. But that's where that normal range came from. But certainly we want to go to the optimal range. And I spell those out in my book too. Something like that. I just think it's so important that we know these numbers and we work to make them optimal, not just normal.
Wonderful. Can you give us a breakdown of some optimal numbers for hormones?
Yes. Well, one of the hormones that I find is really important to check, and this is one of my other 4 key markers, is DHEA. DHEA in women and men spike in our 20s. And then it goes downhill from there. But the healthier, the more optimal our number for women over 100, ideally around 200, for men over 200, ideally around 300, depending on your lab. So Canadian lab reporting or European lab reporting might use different measurements than we use in America, but I put those in my book as well. So we want optimal levels, because the more optimal they are, again, the healthier bones we have, the healthier function, immune system, and less likely we are to get disease, and also more resilient. I would say that healthier DHA levels are certainly associated with more resilient bodies. So that's one. Progesterone, as we age, in the postmenopause, we expect to see low levels of progesterone, but we still like to see them in the whole numbers. But if we've been like pedal to the metal, if we've had significant amount of stress, we're running high cortisol, and for whatever reasons, or we can tend to see really low levels. And when we're ovulating, we like to see that number above 10, ideally around 20. On day 21 of our menstrual cycle. So we start to see that decline, certainly in our mid 30s. So we like to see whole numbers of that in the postmenopause. I often use in many of my clients, really even if they're 70 or 80 years old, using bioidentical topical progesterone cream. And I created a progesterone pregnenolone combination, pregnenolone, another one of the mother hormones. And topically, so that we're not taking oral formulations, but just to help as a balancing formula. And that can just help support us. If we were living in the Amazon, in nature, I really doubt that we would need much of any supplementation. But because we are exposed to toxins, we're living indoors, we're not getting enough environmental healthy exposures of nature, that's where I recommend bioidentical hormone replacement to help us through that. So those are two of the big ones. And then, it varies too with estrogen and with testosterone, but testosterone is another hormone to check in women as well.
So do you think that there are times that we should supplement with estrogen, like with bioidentical estrogen, or is progesterone and pregnenolone and DHEA enough?
I typically start there. Now, I think that because both of those, DHEA, progesterone, and pregnenolone, all of those will metabolize down to estrogen and testosterone as well. So I think it's a good place to start. And often, too, adding in prescription estrogen and or testosterone. Now, if a woman is postmenopausal, we avoid oral hormones. Let me just say I avoid because many definitely prescribe it. I avoid oral hormones because, especially oral estrogens. So if we're over 56, I would definitely work to get someone who's on oral estrogens to a transdermal estrogen, a topical estrogen formulation. And again, a little bit goes a long way. We know that estrogen is important for brain health. It's important for our hormone receptor status and the balance with progesterone. But again, many things. We have, environmental estrogen exposures, dietary estrogen exposures, and certainly the breakdown of our other hormones also produce estrogen. So a little bit goes a long way, but transdermal is safer than oral estrogen, especially over age 56.
You said dietary sources. Is that when we're consuming animals that we're getting their hormones?
Yeah, absolutely. And, certainly, and from animal sources, and then just isoflavones or estrogen like from soy. And that's another place, again, healthy estrogens, but still other estrogenic forms.
Got it. So we got to be careful. Like I've seen that in people who eat tons and tons of soy. They can get weepy easily. And I've seen that in a few friends that their mood changes when they eat lots and lots and lots of tofu. So I
Mm.
thought that was really interesting that something as simple as either cutting down on the soy or cutting down on the meat can alter your hormone levels. Now, I do have a question about your keto green. Do you ever have someone do it vegetarian?
So I do have. I've had quite a number of vegetarians, even some vegans, go through the program. My program, I have my 10-day Breeze Through Menopause Masterclass, as well as my Magic Menopause program. So I go through the keto green lifestyle with that. So they will substitute with, I typically recommend miso or tempeh non-GMO fermented soy as an option to use as a
Hmm.
protein option. And I give vegetarian swaps. Like I have what's it called? No meat meatballs. So made out of nuts and some nutritional yeast and good combinations like that. So you definitely can. And one of my good friends, Rita Marie Lascalzo, we have long conversations because she's vegetarian and, I've got her going keto green and she's doing it her vegetarian way. So I always have to get recipes from her. Like, and if they don't eat any yogurt, there's like you could do coconut yogurt with chia seeds, and vegetarians tend to get more carbohydrates in, but still with the intermittent fasting can push their bodies into ketosis. They tend to have a harder time initially because you're weaning off the grains. You can still have them in keto. I don't villainize any food source, but I want to get your body into fat burning mode because we use fat, ketones for fuel in the brain better than we do glucose post menopause. As our brain is aging, it's really important that we work to use ketones for fuel for brain health. And I've seen that clinically, and we definitely need more research on it. And I hope that more research is in the works in women post menopause. But other than my online programs and the clinical work that I've done, I haven't seen very many studies. But we know that gluconeogenesis, using glucose for fuel in the brain, is an estrogen dependent process. So, hence, that's why we experience the brain fog. It's not early Alzheimer's. But
Mm.
if we don't address this issue, we don't use an alternate fuel source for our brain, we will be starving our brain.
Very interesting. And also, when we have high blood sugar and high insulin, it's it contributes to the plaque that can build up, or at least it interrupts the ability to remove the plaque from the brain. And so, there, more and more we're seeing that if we eat a diet that's high in grains, for example, eat a diet that's high in starches, that we're more likely to develop dementia than diets that are balanced with healthy fats and lots of vegetables that are not starch based.
Yes, yes, 100%. And that's where Keto Green comes in because when we can push our body into ketosis, we get into a highly insulin sensitive state eventually, long term. So what we see, what I've seen in my clients, again, online and around the world, regardless of where they live, we'll see an improvement in their hemoglobin A1C, a marker of better blood sugar control. Another marker that I think everyone should know their number of their hemoglobin A1C, just like they know their number of the weight on their scale. So, so looking at that, becoming insulin sensitive by getting your body into ketosis. And one thing that's so important that I drive home in my programs too is like, 3 healthy meals, 2 to 3 healthy meals a day, but no more snacking. No more snacking. Give our body a chance to become insulin sensitive, and that will improve the longevity and the quality of our life, let alone the quality of our thoughts, our brain function, and our clarity. Now I'm 52 with a 10-year-old Ashley. I got to keep brain clear for a long time. Her teenage years are coming. So
That's awesome. What about the cravings? Okay, so like if someone speaking from experience, when we're out of balance hormonally, one of the things that comes with PMS is cravings, especially nighttime cravings. I know chocolate's stereotypical, but I've actually craved other things that were bizarre, and I'm sitting there going, okay, I know my period's coming soon because I'm craving chicken. Like, what's going on? I'm craving at 11 at night. My body's going, I want a steak. And I'm like, nope, I don't eat steak. What's going on? So I just think it's interesting. And my iron levels are totally fine. So it's, this, sugar cravings or cravings for food that can happen, like you said, 2 weeks out of the month. That's one thing to start cutting back on sugar and have cravings for it because our bodies are addicted to sugar. But it's another thing to shift the diet to balance hormones, and then you're saying no snacking. So can you walk us through how to support us in this transition, especially if cravings are part of the symptoms that they're having of their hormonal imbalance?
yes, absolutely. And it's something like I'm with you. I tell you, I struggled. I remember my ex-husband at this point telling me, that's a whole nother story, but I talk about it in my book. That you go to sleep thinking about food and you wake up thinking about food. And I was like, you don't? I mean, really? I mean, like I just love food. I had cravings all the time. And I was very, I was working, running two medical practices, running a family, all that stuff. And I mean, just food has occupied my brain cells for as long as I could remember. So now, over the past decade and a half, I've been completely free of cravings, unless I've fallen off the wagon once or twice, but almost completely free of cravings. And this is how we do it. This is how we do it. And I've walked many women through this successfully because physiology drives behavior. Willpower is physiologic. So we've got to empower our physiology to improve our willpower. And so it's not like I can think myself willpower. I'm just going to do, well, God bless you if you can. I know that I've got to empower my physiology to enable me to say yes when I need to and no when I don't. And so one of the thing is starting off your morning ritual or power hour, starting off your day with the nutritious right steps. And so for me and my clients, we do a scoop or two of Mighty Maca greens with maybe a tablespoon of apple cider vinegar to add in some, good fermentation, good enzymes right away. Maybe some lemon juice to add additional digestive support and alkalinization, as well as some vitamin C, a little bit of water, chug that down. Start working the digestive juices right off in the morning so that you're able to completely remove anything else that our body hasn't digested completely, as well as just get started with a good energy boost for the day, hydrating our body and getting some good alkalinizers in there and nutrients. So that's one thing, is to start also starting with healthy fats first thing in the morning. So the example I gave you of the keto green breakfast with the salmon, capers, maybe some olive oil on it, greens that are sauteed in ghee or coconut oil are perfect example because you want healthy fats right off. You're not having any or very low carbohydrates in that meal. So your blood sugar is not going to spike. That's going to cause you to want that snack in 2 hours when your blood sugar has dropped back down. So another thing you can do is have a keto coffee or a keto tea in the morning. So a cup of green tea. Now, coffee is one of the things that I love. I always look for the research. Like I said, I was a researcher even before medical school, and I look for the research to support my vices. So coffee, wine, and dark chocolate. So I definitely know that there are very powerful health benefits for these three vices of mine. But I know that caffeine also pushes my cortisol and my adrenals when I'm really stressed. So I have to remove that from my diet. And that's an important thing for women to realize because sometimes we're just in the habit of doing something versus, but it's not serving us. So we need to remove some of those habits. So sometimes to change our willpower for the whole day starts with changing those first steps in the morning. So either, if you're, keto coffee or keto tea. So that's adding a tablespoon of MCT oil, so medium chain triglycerides. A tablespoon is plenty, a teaspoon to a tablespoon. You could add some ghee in, so call it a butter coffee. Some people call it that, or keto coffee or tea. And you can add some collagen peptides in. I like to add collagen peptides in when we get older because it helps with our fascia, our flexibility, it's anti-aging, and just good nutrient support as our collagen levels decline as we get older too. So that's a powerful way to start. And again, that keto green breakfast or keto green shake after anywhere between the last meal should be between at least 12 and a half hours to 15 hours prior. So your dinner to breakfast, I like that intermittent fast to be between 12.5 to 15 hours. And you work up to it so you're not like clawing at the cabinets or succumbing to a binge, right? Because you're like, I'm so hungry. But the research shows, and this is important, published in Journal of American Medical Association in 2017, June or July of 2017, looked at women who have had breast cancer, and they were less likely to suffer recurrence if they had 12.5, at least 12.5 hours between dinner and breakfast. So intermittent fasting. So we know we want to get that. That's going to improve our life, and it does nothing to diminish the quality of our life. So that's what I recommend in my clients, and that works really well. So that first meal, you want healthy fats to start your day. And often I hear from women, even if they've snacked their whole lives, they will eventually have to remind themselves, oh my gosh, 5 hours have gone by. I need, I want to have lunch now. It's like, the cravings are gone. The snacking's gone. That's a function. When you can get into that ketosis, that fat burning state, and you're fat saturated, you're going to have less cravings and to completely eliminate those cravings altogether. Now, when you're cycling, when you're on your period, now that's a special time period because our progesterone levels are peaking, estrogen's high, all our hormones are high. Your body's like, that's the stage when your body's like, okay, I'm going to have a pregnancy and I need to support a baby. So, we have these high levels of hormones, and that's going to definitely make us more susceptible to interesting cravings. So there's two things I like to do here in this state when you're like in the menstrual craving cycles is like, okay, well, listen, what is my body asking for? So if it's asking for red meat, what do I need? Healthy fats, maybe some methylated B vitamins, maybe what other nutrients do I need to give myself? And remember to start your day off with that, or make sure that your next meal will have, higher levels of those nutrients. That's important. And then the chocolate craving, and that's really, really normal during PMS. And so just thinking, okay, well, what's the best quality dark chocolate I can have at this stage? and treat yourself in that way. So I'm all for that.
Very cool. I like it. I like it. If you get the super, super, super like dark baker's chocolate, but totally organic, right? And then you dip it in some almond butter. No, nothing added to the almond butter. Like you could even make your own almond butter. and or cashew butter, or you name it. We could make a hemp butter, use the Vitamix, and then we could just dip a little bit of that dark, super ultra dark chocolate, and there's no, it doesn't, it tastes super bitter, but it stimulates, it stimulates the endocannabinoid system. So it has its own, I forget the name of it, but it basically makes you feel super happy. So it
Oh,
doesn't
yes.
taste good, but it makes you feel good.
Endorphin-like effect. Absolutely. Yeah, just releasing those good hormones. And dark chocolate will do that. That's the nice thing about it. And I love the idea, dark chocolate with almond butter. Oh my gosh, add some cinnamon on top of there or yeah, that's nice.
Right.
It's a good idea.
Now, in terms of going really low carb, or at least really responsible carbs, so we're avoiding processed sugar, we're avoiding the starches, you're filling up on lots of wonderful vegetables, a variety of vegetables that are non-starchy vegetables. What about stevia? What about alcohol sugar, wood sugars, those things that people use to sweeten their tea or their shakes or whatever? Is stevia still okay? Are there sweeteners that you still recommend, or should we go completely sweetener free?
So there's two-part answer to that question too. I mean, I'm fine with stevia. Stevia, xylitol, monk fruit sweetener is now very good, very popular. I've used that in my keto green shake, and I like that. Use a little bit of stevia just for a slight, cut the bitterness of my herbal formula and my mighty maca. A little bit goes a long way. I tend to recommend to my clients that they work to wean off adding any additional sweeteners to their foods or their beverages. Every once in a while, it's absolutely fine, but I've seen the 1 pack, 2 packs. I don't know how people do it. Stevia is so bitter, but a couple packets of stevia in their tea or something. And so like we'll try a little bit of, vanilla extract instead, or try blending it with some cinnamon and cardamom instead, and just see if we can do that, or gradually try to reduce, because our take, just to be able to taste flavors more fully. And I think it's good to periodically detox from our sweeteners as well.
That's a really great way to put it. Now you're describing this diet that seems like a very responsible version of the ketogenic diet, because the ketogenic diet that I did when I worked with a naturopath, it was like every week, went back to her clinic for 3 months straight, and she monitored what I ate, and measured my body mass to make sure I wasn't losing muscle.
Muscle. Mm-hmm.
Yeah, make sure we were losing fat, not muscle, or maintaining. And, just checking in, giving me tips here and there to try to dial it in. And it was like every week she really wanted me to eat cheese. I'm like, I can't. I'm allergic to milk. So it was a lot of like the how she liked to do it with her patients was the bacon and the cheese and the heavy cream and the oil, and not really a lot of vegetables, and definitely not fruit, and then some meat, but not a lot of meat. So it was just a very heavy fats, lots of animal-based fats, definitely not a good omega-3 to 6 ratio. And so I think a lot of people have that in mind when they think keto. What you're describing is a super amount of vegetables. And like, how many cups of vegetables a day would you want people to eat?
Yeah, it depends, raw or fresh. I would say as many as it takes to get your urinary pH alkaline, honestly. But again, recognizing that there's more things to that. And that's where it makes a difference. So what I would have done differently is, number one, I'm dairy sensitive. So there's no dairy in my recipes. There's always an option, but there's no dairy in my recipes, nor are there grains in my recipes, because it will get through this menopause, our bodies are really great conservers of energy. And so we will pound, we will pack on the weight. Ashley, I remember patients coming to me and telling me, Dr. Anna, I'm not doing anything different, but I'm gaining 5, 10, 20 pounds. And I was like, yeah, sure. You're probably not exercising as much. Are you more sedentary? What's going on? And then it happened to me, right? 5, 10, 20 pounds. And I wasn't doing anything different. And I'd been over 240 pounds and had lost 80 pounds, or actually 80, 90 pounds. And then when menopause hit, those weight, the second menopause, because I reversed it at 38, and then at 48 went into natural menopause again. And so the weight started coming back on. And Ashley, that's what dove me into keto, the ketogenic diet more. So I was already detoxing pretty low, following my mantra, no white, no wheat, no sweet, very little red meat, and if you can pick it, peel it, fish and hunt it, milk it, grow it, then you can pretty much eat it. And I'd been living that lifestyle. But menopause still kicked me in the butt with that weight gain. And if anyone's lost a significant amount of weight and then see the scale starts to rise despite not doing anything different, and I know for me, panic set in. And so I was like, okay, well, the ketogenic diet, I've tried it on my patients in the past, who'd had seizure disorders or needed rapid weight loss. But anytime I did in the perimenopausal patient, they would experience irritability, like, hey, I just don't like how I feel on it. And for myself, I called it going keto crazy. I was irritable. I was on edge. I mean, I didn't, I'm like, how did I react that way? And so that's what took me back to the science books, back to kind of my grassroots and look at, okay, well, what's happening with my urinary pH? Am I alkaline or acidic? Not talking blood pH, just urinary pH is a marker of health. The higher alkalinity in our urine pH, the less metabolic syndrome, diabetes, cancer, diseases, healthier bones, et cetera, that we have. Research has proven that. So as a marker, what's going on? And my urine pH, surprisingly, was 5. Very, very acidic, or lower, because that's the pH scale that I had on my test strips. And we want our urinary pH at least to wake up 7 and go to bed at 7. And really like to see that. That makes for a better feeling in our bodies. And so many things can affect nutrition, hydration, stress can all affect our urinary pH, exercise, all that can affect our urinary pH. So the keto, when I was trying to really restrict my carbs, I was getting very acidic. And that's why I started pounding on the alkalinizers through, adding extra mighty maca, adding, apple cider vinegar, lemon juice, adding lots of dark leafy greens like beet greens and kale and chard, sauteed or slightly blanched, and just adding that on until my urinary pH was alkaline. Then I pushed the ketosis more through intermittent fasting, not so much through heavy fat, heavy protein meals. And that's what really made the difference. And then that 20 pounds, 18 of it was gone in 6 weeks when I stayed keto green. And that was really, really powerful realization for me. And that's when I then took this is back when I was 48, so almost 5 years now. I took 8 of my most difficult weight loss resistant menopausal patients, and I put them through the same program. I made them get alkaline, check their urinary pH daily. They hated it at first, but they loved it later. And get alkaline first, then get into ketosis, and created meal plans and intermittent fasting days. And they all did incredibly well. And that's when I started. That's why now I have my online programs and now my book to really get the word out that it's that easy. It's that easy. And when you figure out what works for you, you individualize it even more. And your ketogenic plan was somewhat individualized, that she was monitoring you and monitoring your muscle, which is really great. But like just checking your urinary pH, getting that alkaline, finding out what a difference that makes for you and how you feel. That's where I find we can really move the needle for the long haul.
Do you have any recommendations for pH test strips? I have a really neat pH test strip that is you can use for saliva and urine. But do you have a brand that you really like that you recommend?
Well, actually, as a matter of fact, I do. I need to send you mine because there are pH test strips, and then there are urine ketone test strips. So me being naturally a little bit wanting to take shortcuts or simplify my life, especially with kids, I created my own urine keto pH test strip. So it's a urine test strip with a keto pad on it and then a blank pad in between, and then a pH pad. So because I found through studying that sometimes the pH in keto reagents mixed, and that didn't clarify reading. So now we've got this Keto Ph test strip. It's very inexpensive. It's, I think, $13 for 100 test strips, and you can check. I have my clients check at least 3 to 4 times a day when they get started to see what's going on, to be able to read it. You can also just get pH Hydrion paper from any pharmacy. It's probably the one you're using, and it's just a roll of pH paper, and you can use it on saliva or urine, and that's a great way to do it too. And yeah, so that's a good start. Many times I hear criticism with urine ketone testing, because if you're in ketosis for an extended amount of time, it seems like it should be like over 2 months. I don't know, because I've never gotten where I've not seen ketones in my urine, because I always have intermittent feast days at some point within 2 months that takes me out of ketosis. So I tend to always see ketones in my urine, that if we're in ketosis for a long time, we'll no longer see one of the types of ketones in our urine, but the blood ketone testing is the gold standard. So we can use blood ketone testing as a good monitor. It is more expensive, but on a daily basis, especially if we're checking to see how we're doing throughout the day, urinary ketone testing is typically fine.
Very cool. I would love to get a bottle of yours.
I am sending them to you.
Awesome. Thank you. Very cool. I also love to do, so I'm totally putting you on the spot. I also love to do for the listeners, we do contests, or not contests, but just like a draw. So if you want to give a bottle to the listeners, we have a Facebook group, Learn Your Health Facebook group, and then we'll post a post about this episode, and everyone can comment what they loved learning from you. And then we can do a giveaway. So you can either give away your book or give away a bottle of your urine pH and keto test strips. But we'll do a giveaway for the listeners. So listeners, go to the Learn Your Health Facebook group, and we'll do a really fun giveaway. You got to think about something you absolutely loved learning from Dr. Anna today, and you'll type it in the comments, and then we'll roll the giant dice.
That is
got all
awesome.
the dice. We'll roll them. I've got all the D&D dice, and we'll roll them because sometimes we have 150 comments, so I'll have to roll all the dice, and we'll pick a winner. So we'll have a fun contest there. But I always love reading the comments from listeners of what their aha moment was from a guest. And so you can join the Facebook group too, Dr. Anna, if you'd like, and read the comments from the listeners. It's always a lot of fun. So it sounds like you started out with the ketogenic diet was something that was in your tool belt as a doctor. Just kind of like you have all these different diets, and you knew that it was good for people who had drug-resistant epilepsy, and then can you tell us a little bit about how that came about? Like, how did you discover keto? How did you was there a light bulb moment when you went, aha, I'm going to do this for myself? Was there an aha, or were you just kind of searching, like, I need to find something, and what's that something? And how did you, because there's so many diets out there, how did you decide keto was the one for you?
Yeah, that's a great question. First, though, I'm definitely in your Facebook group, and let's do Keto pH urine test strips with Mighty Maca and a book. We'll do all.
Awesome.
So, yeah, definitely get that out to your listeners. They're awesome. Again, I've been so really blessed by your podcast. You're blessing so many people's lives. So thank you for that. When it comes to how did I get, keto, like way back when I think must have been a teenager. That's when the Atkins diet was really big, right? And they were saying, all the controversy. Atkins is a ketogenic diet, right? HCG diet is a ketogenic diet in a way. And so I've experienced, and probably like so many listeners, I've experienced personally and professionally probably close to 100 diets or so. I have no idea. But always having been a fat kid, struggling with my weight my entire life until, when I reversed menopause and figured out how to do this, that made a difference. Struggled with craving, struggled with weight gain. I would joke, literally walk by a pastry shelf and gain 5 pounds, and then finding out part of that was food sensitivity. So every step of the way, I recognize like dairy sensitivity, put on 3 pounds. If there's a slight contamination of my food with any cheese or dairy, I'm 3 pounds heavier the next day. And it's not that I like recognize very clearly, okay, did not eat 3 pounds of cheese, right? Didn't eat a morsel, right? It's so frustrating. And so when I was facing this, and I'd been studying, always researching, studying functional medicine, fasting, fascinated by all this stuff, what could help. I knew that keto was also good for weight loss. And so, well, let me just restrict carbs even more. And then, gosh, these menopausal pounds that are coming on, despite not doing anything different, that's got to help. But then my brain health was sacrificing. So I think it was just knowing about the ketogenic or carb restrictive diets through working, trying to solve difficult client cases, that made me desperate enough to try it again for myself.
Got it. Got it. What did you try a bunch of other diets first and kind of have, did you have like 30 failures and or the Edison sort of like diet light bulb moment, or did you do a lot of research and then try the keto diet?
No, I think it was just because I'd always been working on it. I had health and fat loss programs with my clients. So working with, functional pros, detoxification diets. So a lot of these alkalinizing diets already eliminated sugar, already lived a Mediterranean lifestyle. So I think this was just, was just that one that, um, I felt had the most potential for fat loss and for brain health
That makes sense.
at that time.
Right, especially because you were already informed by your clinical experience, and that you knew you wanted an alkaline. You wanted to make sure the body was not going acidic with a diet. Like the Atkins is very acidic, and so you're looking at the vegetables as the main source of micronutrients, and bringing the body back into balance so that the pH is not going off kilter by an unhealthy form of ketosis. So I like that. Are there any cultures that you can think of that have naturally eaten this way in the past? Or, sometimes people say, well, this is so new, it's not really studied, but is this diet, has this diet been done naturally in cultures that, since you've traveled around the world, did you see this way of eating helping cultures, helping people?
Well, actually, yes. And even going back to that aha moment. So understanding the ketogenic, the aha moment that I had was adding in the alkalinizing component. And when I was going through and figuring this out and was checking my urine, I'm like, why am I so acidic? And then getting alkaline and feeling this improvement, I went back to the literature and did a scientific search to see if anyone had put alkalinity with ketosis or ketogenic diet before. Lo and behold, I found a paper published 100 years ago in Cambridge by a Dr. Wigglesworth that actually did combine the two to show improved ketonuria, improved ketone secretion in the combination of adding alkalinizers in the study, in the animal study model that they had done. And then it disappeared from the literature for all these years. It was pretty fascinating. So that was like my big aha moments, like, oh my gosh, not only like for me clinically, I was feeling better, thinking better, but here it improves the ketones that are the number of ketones available potentially to my body as a fuel source. So I'm like, that made perfect sense to me. So that's where, and then looking from the cultural standpoint and traveling, the Mediterranean diet, I do believe that's a keto green diet, minus the pasta in most places. But, looking at some of the cultures that I've experienced in the Middle East, lots of fish, lots of fresh fish, lots of greens like the taboulehs and the vegetables. And there's always healthy vegetables at a table. But there's also the concept, and this is a concept that, has been practiced in traditional societies for millennia, is that, breakfast, a healthy big breakfast, so breakfast like a king, lunch like a nobleman, dinner like a pauper. So dinner in many of the places that I experienced was the midday meal, like the heavy midday, like the biggest was either, your breaking fast or your midday meal, and a very light to non-existent supper. And that was one thing that made the aha moment for traditional societies to create this longer intermittent fasting. So I encourage my clients to do that, to make dinner very light, or, so that we have that extended period between our last meal to the time too that we go to bed, so that our body is not digesting and working on digesting our food while we're sleeping. Rather, we want our body to be restoring, regenerating, repairing cells, and not have its energy directed towards our digestive system. So the earlier we eat in the evening and the longer we have between dinner and breakfast, the more time that our body is resting. But not this like, oh, I'm going to eat at 8 o'clock at night and then not eat till 2 o'clock the next day. That's not healthy. So we excrete 70% more insulin after 7 p.m. So somehow traditional societies figured that out. The earlier we eat, the healthier we are. And along with that too, as I got more into the ketosis aspect of my keto green component, so the so getting into the fact that we're burning fat for fuel over glucose, intermittent fasting and extended fasting. Now, societies, including several religions, incorporate fasting into their lifestyle. So the Orthodox, like Russian Orthodox, they have over 250 days of fasting a year. Catholics are supposed to have meatless Fridays, right? And fast until after church on Sunday. And so like fasting and that's a weekly fast. That's twice weekly, extended or intermittent type fasting. And, so that's been built into our society I would say, for a reason. I mean, Muslim cultures with Ramadan, extended period of fasting, it must have nutritional benefit. And so in the state, when we get this, alkaline, keto green, when we're using both the benefits of functional medicine principles to get healthy minerals and nutrients in our diet, and then work on getting our body away from burning glucose and more into burning ketones or fat for fuel, we get this keto green state, and there's a high level of clarity. And for me, definitely spiritual connection. It's that ability to stay grounded and be more sane, let's say, than otherwise. So a spiritual clarity that comes with fasting. And that's what we can experience when we're doing this keto green lifestyle as well. So I've seen that in cultures and religions around the world. And I definitely do think the Mediterranean and Middle Eastern cultures have incorporated or are good examples of this traditionally. Now so much, they're still moving away with much more carbs in their lifestyles than before. But even with that, when they're eliminating that dinner, they tend to do better.
When we think about agriculture and the business of agriculture, and we step outside of our own generation and think back 100, 150 years ago, think back even to the beginning of this age of agriculture, and how the argument for grains has been that we're saving lives. We're able to end starvation, even though there unfortunately are people still around the world starving to this day, and that's not because we're not able to grow enough. There's absolutely enough food in the United States alone to cover a few more countries, but it's distribution and unfortunately the politics of more. But the argument is that we're grains, GMO, the big agri and the chemicals used in the agriculture industry are all designed to make enough food so that we're not going to starve, and we're saving lives. But then when we look at the impact of taking our genetics from a place where we were never really meant to eat grains on a daily basis, and dairy, for example, a lot of people genetically are not designed on a daily basis to consume dairy. Food like dairy and grains are emergency foods that we use to be able to survive in times of drought or of famine. We've been able to use them as tools to survive, but now we're eating them to excess on a daily basis, and look what that has created. That 1/3 of the population in the United States is diabetic or pre-diabetic and obese. That heart disease is out of control. That several cancers are growing out of control. I just had a doctor on the show that said that thyroid cancer since the 90s has tripled, has threefold the amount of thyroid cancer out there since the 90s alone. So we're looking at these diseases of lifestyle continuing to rise, and are much of the population is experiencing heart disease. These diseases that now we see are related to a lifetime of poor blood sugar and insulin regulation. And so coming back to this diet of this question of what is the best diet for everyone, there's not one right answer, right? Because we need to find out for ourselves in this snapshot in time, what's the best for me. If we're using food as medicine, not everyone takes the same medicine, because one person's cure is another person's poison. But definitely, I think everyone in the world will benefit from more nutrient dense foods like vegetables. Of course, looking at the individual, if they have digestive issues we need to correct, then they might not want to jump on a raw salad at the moment. Are there contraindications or things you'd like to point out, things that people might have that they need to correct before jumping on a keto green diet? Or maybe is age a factor? Should children not do it? Or do you feel that this is safe and healthy for 100% of the population?
I feel this is safe and healthy for definitely the majority of the population. And now I've had clients with kidney disease, cancer, lymphomas, and really critical to just overall healthy bodybuilders doing the program and doing well. The key thing is that we tailor it. I always say diets fail. Well, it's a 4-letter word with the word die in it. So it's a bad word to begin with. And secondly, because it's only about 25% of what we're eating. We focus so much on what we're eating. But what we find, and this is why the urinary pH and ketone testing is really important, because we see how our lifestyle affects us. I mean, I was explaining this yesterday to another medical colleague, and we were having this discussion. He has his diet plan, I have my diet plan, and we were talking about it. It's just, just how do we make it work for ourselves, right? How do we make it work for the individual patient? And the big thing that I recognized is that if you have the same meal and you're stressed and pissed off, you're going to be very acidic. You're going to be stressed. You're probably, you can't even gain weight. You're not going to digest the food well. We know that. And versus the same meal and you're sitting and having laughter, having great conversation, having fun with a table of friends. I mean, you can already feel the difference in energy about that. Oxytocin's flowing, and sure, the wine's probably flowing. And the next morning, and this is my clients realized, I woke up alkaline. I felt great. I woke up alkaline. I had a great night's sleep. I mean, there was the difference. So there's 25% about what we eat. The other part's the lifestyle. When are we eating? How are we eating? What else is, are we being exposed to? How much are we enjoying nature? How's our circadian rhythm? What are our hormones doing? So that 75% of it is where we have to fine tune this for ourselves. Start with this good nourishment. And in my book, I really try to make it easy with the 10-day quick start detox plan. I mean, it's a little restrictive, but I want results, and I want people, look, no more mediocrity. We're all striving for excellence. And that's why I love your podcast, Ashley, because you are doing that. You're hitting it from all angles, the lifestyle components that you touch on in your podcast as well, the mental health, the spiritual health. I mean, all those aspects. and just bringing the right, learn true health, bring those concepts into our being, because it's not just about what we eat. So we have to incorporate and discern what works for us and what doesn't. And that's what works is what we need to do more of.
Love it. Love it. Yes, exactly. If only we could just eat broccoli and have everything work. If only it was that simple. But it's also fun. It's so much fun to be on this health journey, and so many people have shared with me when they've come out the other side that their cancer was a blessing, that their polycystic ovarian syndrome was a blessing, that their diabetes was a blessing, or their major thyroid issue that left them suffering for like 10 years before or their Lyme disease that left them bedridden for several years, or their chronic adrenal fatigue, all these things that were horrible in the moment and like lots of suffering, figuring out how to get out of it and heal their bodies, and then be so inspired that they want to dedicate their lives to helping others with all the knowledge that they accumulated, just like you've done. It left them with a life mission, left them feeling a sense of purpose, and then fulfilled their life knowing that they're helping all the other people. So they feel that hardship was a blessing, and we can turn around and we can look at the hardest times in our life that have brought us the most sorrow and say, I'm grateful. I'm sad this happened. I wish it hadn't happened, obviously, and I'm grateful for the lessons I've learned from it. Just like I've lost both my parents, I would do anything to have them back, and because I lost them, it helped me on this journey to help others. So I can take that and be grateful for the lessons along the way, just like, and also my own health that I've been working on, my health journey. I'm grateful for, because how much better I feel, and it's given me tools. It gives all of us a sense of empowerment when we shift our diet and lifestyle, and we see that we feel better and we see better lab results. That is a huge sense of empowerment, because we were raised to believe that the doctor's on a pedestal with their drugs and their surgery, and that we are helpless and powerless. We have to wait to become broken and then go see them and they're going to fix us. And that's that mentality that we were raised with. And instead, we need to shift our mindset that there's no one on a pedestal, and we're the experts of our own body, because we're in it. We're in our body, and we need to learn from wonderful doctors like you to help us navigate the lifestyle and the diet that we choose to heal our body with. And then the drugs when needed. And I do have a few questions about that. So for women who, I keep saying people, but men don't have uteruses. So for women who have had hysterectomies, can you give them some guidance? Because I know we do have some listeners who've had hysterectomies, either full, or maybe some of them still have their ovaries. When someone's had a full hysterectomy, should they definitely be on bioidentical hormones, or definitely be on the pregnenolone and progesterone cream? Or are there times when they can do lifestyle and diet, and their body is able to have healthy hormones? Or if you've really removed organs, you should look into bioidentical hormones. What's your stance on that?
I really would say that 100% I would use bioidentical hormones. A little bit goes a long way. And research has shown when we've removed the ovaries, we have increased, just by having your ovaries removed, you have increased risk of heart disease, morbidity, and mortality. Anytime the ovaries are removed before age 65, research shows that when we replace estrogen, we know estrogen in the studies that have been done, that decreases or attenuates that effect. So if we've had a complete hysterectomy, ovary and uterus removed, I would recommend bioidentical hormone replacement therapy, and to start sooner rather than later. But again, I don't think there's an endpoint. If we're doing things well, if we're living, healthy, if we're not driving through for 3 meals a day, in other words, we should be able to do bioidentical hormones, at least a low dose topical progesterone and or DHEA, very, very well and very safely. And that will make a difference in the quality of life. So I'm glad you asked that question, because I know that so many women unnecessarily suffer. And again, the convention is that once we've removed your uterus, you don't need bioidentical progesterone. However, when I started using bioidentical progesterone for other reasons in these clients, they would always tell me, I feel like a cloud has lifted, Dr. Anna. And so that's where I really understood, and I dug into the research of progesterone's neuroprotective effects. And so certainly in both men and women, it has benefits well into old age, well into old age.
Very cool. And for women who still have those organs, but still have low progesterone, you're saying get your book, do the 10-day detox, do the 21-day program, get on your maca, get on the keto green diet, and give it a few months, and then maybe go get some testing and see if that everything was enough, or if they still need some low dose bioidentical hormones to kind of get them up. Because I know you said that you really would prefer to support their body to make it on its own. When would a woman with their uterus and ovaries also incorporate bioidentical hormones?
I use bioidentical hormones myself. I recommend it, again, created natural products. Also to create natural sources, paraben free in our transdermal creams, etc. So I do highly recommend it. Certain things like, if we were living out in nature and we're able to get as much as we can from the environment, the Earth's magnetic field and sun's magnificent energy, we might not need it. But there's the rare exception. I would say less than 1% do not need bioidentical hormone replacement in the postmenopause for a few reasons. One, because we need it to maintain healthy bones, healthy, cognition, brain health. But also, I'm a sexual health expert. So pelvic floor, women suffer. Hot flashes eventually go away, but many women suffer for 5 to 10 years. My program, because insulin resistance is one of the reasons women suffer, often at least within 2 to 3 weeks, women's hot flashes have nearly been eliminated or improved. But yet, over time, the pelvic floor changes continue. So vaginal dryness, loss of lubrication, discomfort, urinary leaking, all of those problems continue. So that's where I add in DHEA. DHEA with other ingredients, natural moisturizers, in a topical form that, I use Julva, which I created. It's Julva, and it's an anti-aging topical cream for the vulva that does contain some DHEA in it. And also plant stem cells. So using plant stem cell technology to help improve and, add to the anti-aging benefits there, because this pelvic floor discomfort, and actually there was just a study done in the UK that looked at women in the 35 and over, and even women in their mid 30s are already struggling with vaginal dryness. 25 to 35% of women who answered this survey were struggling with vaginal dryness and discomfort. Well, that causes decrease in pleasure, decrease in intimacy, less intimate connection, and that can then lead into more relationship issues. And so it's important to, like I said, oxytocin is the most powerful hormone. So we certainly don't want to lose that aspect of intimacy. And if we have pain every time we do something, if we have pain every time we have sex, why would we want to have sex? And that's an area that's so underserved in our medical system that I lecture, I train physicians in this area using bioidentical hormones, using vaginal hormone therapies. And I think we are underservicing the population. Many women and men are suffering unnecessarily, but a little goes a long way. I am not for high doses because that can affect the way we think, the way we act, but low, a little bit goes a long way.
Very cool. Thank you. Awesome. I want to talk about your book and your program. Can you let us know? So your website, which is dranna.com. So it's DRANNA.com. Tell us about your book, and I know you have a program as well. Can you tell us about that?
Yeah. So I'm offering your listeners my Breeze Through Menopause 10-day masterclass, which is really good. No matter what age you are, you're gonna find something. But definitely, if you've ever struggled with hormone imbalance symptoms, so 10 days Breeze Through Menopause masterclass 5 to 10 minute quick videos from me each day for 10 days, a 10-day menu option, and just kind of the kickstart into the keto green lifestyle. So that is a great accompaniment to my book, The Hormone Fix. So the Hormone Fix is being published by Ballantine Penguin Random House. It's already #1 on Amazon in pre-orders for menopause. So I'm really excited about that. And it has a 10-day keto green detox, as well as 21 days of menu, but a whole chapter on stress, a whole chapter on vaginal health, a whole chapter on like when, like how we can figure out other things that are impeding the quality of our life. So more than nutrition, it's the lifestyle component, as well as the hormones and the testing. So how we can be our own, like empower ourselves to be our own physician. I don't want anyone to give control of their health over to anyone else. And I say that as a doctor with all love, as an egotistical maybe doctor, like I got up my ego too. That's why I say it takes 90%, it's 90% health and lifestyle. I'm keeping 10% for myself. So just through the guidance, right? I'm meant to be your guide, teacher, helper, as each individual, as everyone listening reclaims their own health, becomes their own master physician, their own, leader for advocate for their health. And so this program will help. I'm really excited about it. I wish I had it decades ago to help my mom and to help so many other clients, and really excited to see, because we've had, thousands of women in my online Magic Menopause program doing really, really well, just change the quality of their life. And I love hearing those stories. So I definitely want to hear more of those.
Awesome. Yeah, I'm very excited. That's going to be a lot of fun. I'm going to make sure the links to everything that Dr. Anna does, her book, her mighty maca, everything is going to be in the show notes of today's podcast at learntruehealth.com. So you can just click on the notes that accompany the episode today, whether you're listening through iTunes or listening on the website, learntruehealth.com. Dr. Ann, it's been such a pleasure having you here today. I'd love to have you back anytime you have another book coming out or you have a new topic you want to explore and teach. It's been such a pleasure having you on the show today. Is there anything you'd like to say to wrap up today's interview, or is there anything that's been left unsaid that you want to make sure that you say?
Oh, I just want to reiterate that for everyone listening, no matter what you're dealing with, there's hope. And the more care that we take of ourselves, the better care we can take of everyone else. So really to put yourself on your priority list. So I encourage that. I experienced in my own life and have witnessed it in the lives of others. And I do want to tell you that my daughter Amira is blowing up my phone because I had told her I was on your podcast, and she's like, "Oh, tell her I love her." And she said, "I like how she asks questions. She asks exactly what her listeners might be thinking. So be prepared."
That's awesome. I'd say hi to her, but I'm saying hi to her right now. She's going to hear it. So that's so cool. And tell her thank you for sharing the podcast with her friends. This is how we're going to help all of our loved ones, by continuing to share all the episodes that we know will help our friends. We have, this is going to be episode 326. So we have 326 wonderful episodes that we can share with our loved ones that range all kinds of topics. Listeners can go to learntruehealth.com and use the search function to find an episode. So if you have a friend that says, I have a migraine, or I don't know, I'm just drawing a blank on the 325 different topics we've covered, but out of all the ones, sleep and constipation and depression, anxiety, thyroid, you name it. We've probably covered it. And if we haven't covered it, join the Learn True Health Facebook group and tell me. We have actually a quiz right at the top, pinned to the top, where I'm taking suggestions for future episodes. So come tell me what you want. Or if you want Dr. Anna to come back on the show, come tell us what you want her to talk about, because maybe we have some additional questions from listeners that we didn't get to. And that way Dr. Anna can come back on the show and teach us more. It's been such a pleasure. And my head's full now, so I think I'm gonna go make a green smoothie and wish it was your mighty maca.
Oh, Oh, thank you. I appreciate it. This has been a pleasure. Really, thank you so much for what you're doing. And thank you for having me on your podcast.
Absolutely. You're welcome. And thank you for the giveaway we're going to do for all the listeners. I just know they're going to be super excited about that. So listeners can go to Learn True Health's Facebook group. Just search Learn True Health in Facebook or go to learntruehealth.com/group. That'll direct you straight to the group. And look for the post that I'll make after I publish this episode talking about the giveaway so that you can participate and potentially be one of the winners. Yay! Awesome. Well, thank you so much, Dr. Anna. Enjoy your tabbouleh tonight. It's delicious. I can't wait to get that recipe from you.
I'm looking forward to sharing it. Thank you.
Are you looking to optimize your health? Are you looking to get the best supplements at the lowest price? For high quality supplements and to talk to someone about what supplements are best for you, go to takeyoursupplements.com and one of our fantastic True Health coaches will help you pick out the right supplements for you that are the highest quality and the best price. That's takeyoursupplements.com. Takeyoursupplements.com. That's takeyoursupplements.com. Be sure to ask about free shipping and our awesome referral program.